Of care is what they do. And if you and your loved ones are in need of a specialist for disorders or treatments concerning the head or neck, then GBMC is your first choice. Dr. Karen Pitney joins me today for some common signs you should know and have issues about. Okay, good morning there, doctor.
Hi,
How are you
Jimmy?
this morning?
Good.
So what is the most common head and neck cancer?
Well, to start, I should tell you that head and neck cancers are a diverse group of cancers that include cancers of the mouth, the throat, the voice box, and the nose and sinuses. And the most common kind we see are cancers of the mouth and what we call the oropharynx, which is the area in the back of the throat where the tonsils and the base of tongue lives.
Okay, so what are some of the signs and symptoms of cancer of the neck or throat?
Well, just because as there are so many very different kinds of head and neck cancer, the most common signs and symptoms that we see are also varied. They can present with a neck mass. A neck mass in anyone over the age of 40 is very concerning. They can present with hoarseness. A hoarseness in an adult that lasts longer for 2 weeks should be evaluated. They can present with swallowing problems or a sore in the mouth that doesn't heal.
Okay, are the head and neck cancers curable?
They are if they're caught at an early stage. And so that's why we recommend if any of these signs or symptoms are happening with you that you be evaluated so that we can catch it early.
Gotcha. What are some treatments available?
Well, it depends on the kind of cancer and the stage of the cancer. So at GBMC, at the Milton J. Dance Head and Neck Center, we do an extensive staging evaluation that includes a physical examination, x-rays, and evaluation by speech and swallowing therapists to stage the cancer. And then once we know the stage, surgery or radiation or a combination of surgery, radiation, and chemotherapy, depending on the stage.
Okay, well, talk to me about some of the prevention methods and causes that are available.
Right. Well, the common risk factors for head and neck cancer are smoking and drinking. But as we've seen the epidemic of HPV-related cancers in the oropharynx, or the tonsils and base of tongue, HPV is emerging as a very strong risk factor.
Okay, can we talk about some like preventions?
Sure. Well, the best thing you can do is to not smoke. Not
Amen.
Smoke or not use oral tobacco. And then for prevention, the best way to prevent oropharynx cancer, which is HPV related, is vaccination. And we recommend vaccinating children before they become sexually active at usually around between the age of 9 and 14 for the vaccine to be most effective.
Very good. How important is screening for head and neck cancers?
Well, it's very important, especially if there are signs or symptoms. And at GBMC, we'll have an oral head and neck cancer screening event on April 11th, and April 7th through 14th is Oral Head and Neck Cancer Awareness Week all through this country.
Very good. What are some of the screening types?
Well, a good screening evaluation involves just a good oral cavity examination, looking at all the structures in the mouth and the throat. Sometimes this requires specialized equipment, including a scope that we can use to look at the voice box. It involves a detailed examination of the neck to make sure there are no neck masses. And if there's any questions, sometimes imaging or x-rays are used.
Very good. Is there an age people should worry about starting to get screened?
Well, any of these warning signs that would happen in a patient over 30 or 40 years old, yes, we should. That should be evaluated and be screened.
And I guess with baseball season starting and the kids see the major leaguers put that stuff between their cheek and the gums, that's very, very important not to do that.
It's very important not to use oral tobacco or smoke tobacco.
Okay. So where can we learn more information?
Well, you can go to our website, the Head and Neck Cancer website at Milton Dance Jr. Head and Neck Center. There's a headandneckcancer.org national website where there's a lot of information as well.
Okay, very good. Well, doctor, thank you very much for all that beautiful insight. And remember, if you have a problem or you think you have a problem, get checked out and get a screening.
Great. Thanks so much, Jimmy.
Okay, well, speaking of